Καλησπέρα σε όλους. Μετά τη μεσημεριανή διακοπή, να ξεκινήσουμε στην επόμενη ενότητα. Σε αυτή την ενότητα θα έχουμε και δύο εξαιρετικούς καλεσμένους, οι οποίοι είναι διαδικτυακά μαζί μας από το εξωτερικό. Οπότε λίγο την εισαγωγή θα την κάνω στα αγγλικά, έτσι ώστε να τους καλωσορίσουμε. Οι παρουσιάσεις που θα κάνουν θα γίνουν στα αγγλικά και μετά η συζήτηση μεταξύ μας θα γίνει στα ελληνικά. Βεβαίως, όποιος θέλει θα μπορεί να τους κάνει κάποια ερώτηση. Well, dear ladies and gentlemen and distinguished guests, I want to welcome you to this session entitled Evidence and Policies in Cancer, What We Need, Where We Want to Go. Cancer care remains one of the most significant challenges for healthcare systems worldwide. The need for evidence-based, effective and equitable policies is more pressing than ever. In this session, we will explore how data and evidence can form the foundation for better planning, implementation, and evaluation of policies aimed at improving cancer care, both in our country and internationally. Today, we have the opportunity to discuss two invaluable tools. The first is the Cancer Dashboard for Greece, which provides comprehensive data for accessing cancer care, and the All-Can Action Guide for Efficient Cancer Care, which offers practical recommendations for enhancing efficiency in patient care. Through the presentation and the discussion that will follow, we will examine how to address challenges in data collection and utilization, as well as how evidence can drive policies that promote quality, equity, and sustainability in cancer care. So it's my pleasure to be here with such distinguished speakers and to facilitate this important discussion together with Professor Ilias Kyrizopoulos and the panel of the speakers. So, so we have some minutes delay, so we will begin with the first presentation, Accessing and Improving Cancer Care, the Cancer Dashboard for Greece, from Thomas Hofmarcher, Director of Swedish Institute for Health Economics. So can we have, please, the speech?
Dear colleagues, dear friends and conference participants, it is my great honor to be part of your conference with a pre-recorded presentation. My name is Thomas Hofmarcher. I am a health economist and research director at the Swedish Institute for Health Economics. And today I would like to present a new project called Cancer Dashboard for Greece. As I said, I'm from the Swedish Institute for Health Economics. We have existed for 45 years. For a long part of our history, we were part of the Swedish government, but since 2010, we are an independent and private research institute that works together with all stakeholders in the healthcare area, both nationally and internationally. And as you know, research requires funding, and funding for this project comes from MSD, for which we are very thankful. Now, let's talk about the project, the Cancer Dashboard. What is the purpose and what is the content? The Dashboard for Greece is actually part of a greater series on cancer dashboards. We have previously published dashboards for Poland, as well as for Austria and Italy. The objectives for Greece is to create a dashboard-style description of cancer care with different key indicators that are supposed to benchmark the status quo in Greece against international targets or the EU average. And the whole point of doing this is to start measuring different areas in cancer care and to encourage a holistic analysis that will eventually and hopefully lead to the introduction of a national cancer control program in Greece, as well as to support other ongoing initiatives to improve cancer care in the country. In terms of the methodology for the report, we relied only on publicly available information from authorities and from scientific publications. And we got amazing input from two leading organizations, the Hellenic Society of Medical Oncology, ESMO, and its president, Dr. Senia Saridaki, as well as input from the Hellenic Cancer Federation, ELOC, and its president, George Kapetanakis. Now, we published the first version of the IHE Cancer Dashboard Report in October. It's available for free. You can download it. You can scan the QR code, and then you can get to our website and you can download the report. It has 2 forwards by the aforementioned expert that have helped us and that hopefully are actually in this session and will be discussing the cancer dashboard later on. So what is the structure of the dashboard? In terms of the structure, we tried to be holistic. We looked at 7 different areas, starting with the governance strategies related to cancer, followed by the disease burden of cancer and the economic burden of cancer, and then 4 areas which relate to the 4 pillars of Europe's Beating Cancer Plan. These areas are prevention, early detection, diagnosis and treatment, and survivorships. And for each of these 7 areas, we selected indicators that were supposed to relate to strategic areas in cancer care, as well as aims of the Europe's Beating Cancer Plan and other ongoing policy initiatives in Greece. The sources of data and information that we used in the analysis, as I said, they are public and they have been selected, and the selection was guided by the original list of indicators that we assembled for the European Cancer Pulse, which is a website published by the European Cancer Organization. Now on this slide, you see the full overview of the cancer dashboard. So you see, if you start at the left-hand side, you see the 7 areas, starting with the governance and then followed by disease burden, economic burden, and so on. And you see 2 columns in color-coded, and we used 4 different colors for these 2 columns. The first column, color-coded column, shows the status quo of Greece compared to the European benchmark or the EU average. And it can take the color of red, meaning Greece is below the benchmark, yellow means close to the benchmark, green means above the benchmark, and gray would mean that there's no data available for that particular indicator. And for a second column, to the very right, we have recent policy development, where we also use the same colors, where green indicates that legislation is already in place, yellow means that there are active plans or ongoing actions in this area, and red means no plans or no legislation, and gray means there's no data available or we could not grade it. So what does it look like if we go through especially the first column quickly? Then you see that in the area of governance, we have 2 indicators: the presence of a national cancer plan. As you know, there is no formally adopted cancer plan in Greece. That's why we put the color in red. For the National Cancer Registry, you see that we chose a yellow color because the legislation is already in place, whereas the implementation of the National Cancer Registry is still ongoing. We would like to see it, but there are no numbers produced yet by the registry. Nevertheless, given the fact that legislation has happened, we have put the recent policy development in green color. When we look at the second area of the disease burden, the 5-year survival rates, the incidence rate, the mortality rate, they're difficult to assess, first of all, because of an absence of the National Cancer Registry, but tend to be in the yellow or red area. For the economic burden, we looked at the health spending on cancer care. Here the numbers are uncertain, but nevertheless, existing estimates show that Greece spends less than the EU average on cancer care per capita. Productivity loss from cancer is also in yellow color because it's close to the EU average. In the area of prevention, the 3 indicators that we picked, tobacco, smoking, obesity, and HPV vaccination, are all red because smoking rates in Greece are higher than the EU average, as well as the obesity rate, and the vaccination rate for HPV in girls is lower than the aim specified in Europe's Beating Cancer Plan. But in all of these three areas, we see positive policy developments. So therefore, we put them in green. For early detection, breast cancer screening and cervical cancer screening are yellow and green, because the participation rates that we see are either close to the EU average or above the EU average. And as you know, the recent introduction of population-based program for breast cancer in 2022 and this year, earlier this year, also for cervical cancer means that the policy development is positive, so it's green. For the area of diagnosis and treatment, the biggest area, we have several indicators, starting with comprehensive cancer centers, where we used the OECI accreditation system and saw that there are currently no such cancer centers in Greece with this accreditation, which is why we put it in red. But there are plans, of course, by the government to change the situation. When it comes to the human resources, it's a little bit a mixed picture, with the number of GPs and nurses being below the EU average, whereas the number of cancer specialists is above the EU average. For the radiation therapy equipment, Greece is close to the EU average and also to international aims specified. Whereas for biomarker testing, Greece is in the red area, although probably now very recent changes are underway, so this might change very soon. For novel cancer medicines, access to that, it's in the yellow area because it's very close to the EU average. Clinical guidelines and referral pathways is again a mixed picture, because clinical guidelines, well, there are the HESMO therapeutic guidelines in place, of course, so that would be green, but the referral pathways are not yet implemented, so that would be red. So as a compromise, we put this in yellow color. Home care services, well, the number of formally employed workers in these kind of services is very far below the EU average, which is why it's in red. But the recent policy development is positive, with national legislation on a home care service program, ECOTHEN, that was announced last year. And in the final area, survivorship, we picked one indicator for palliative care services. Again, that's in red because the number of care services per 100,000 inhabitants is below the EU average. But also this is an area where there has been a new framework and legislation for palliative care being introduced very recently in Greece. Now, the rest of the dashboard, what does it look like? Well, for each of these indicators that you just saw before, we have essentially one page that describes background information. So why is this indicator relevant? Then it describes the current status in Greece, and then it puts also in some recommendations. So you see here tobacco smoking as an example. One of the indicators we looked at was the smoking rate, which you see in Greece is above the EU average, which is why the status quo was put in red, whereas recent legislation and also the National Tobacco Control Plan are positive developments. So this is why we put the recent policy development in green color. Another example is biomarker testing, where we see that Greece in an international comparison is in the bottom left quadrant, meaning that access is worse compared to other countries in Europe, which is why we put the status quo in red. And also by the time we published the report in October, there were no plans or legislation yet in place to improve the situation. But again, this might have changed very, very recently. And I'd like to finish with some high-level recommendations that follow for each of those areas. In the area of governments, the main aim is to adopt a national cancer plan. I think that's a very high priority. In the area of funding and the economic burden, I think if you look at it in a broad way, I think funding of healthcare is essential, and that's where we should start. And then funding of specific initiatives in cancer care is important and will be needed to ensure more equal access to high quality cancer care for all patients across the country. In the area of prevention, it's all about implementations, because all of these policy initiatives are already there, but it's about implementing them to ensure that we see effects in the real world. The same goes for early detection. So again, the policy initiatives are all going into the right direction, but it's making sure that breast cancer screening, cervical cancer screening is really implemented, achieving high participation rates, and also to make sure that these programs are financed in a sustainable way so they can continue throughout the next few years and maybe even decades. For the diagnosis and treatment, it's really about integration of care services, different care services. It's about making sure there are enough human resources there to help the increasing number of cancer patients. Infrastructure for diagnostic procedures and for treatment is important, as well as biomarker testing to ensure that patients have access to personalized therapy. And then in the final area, survivorship, expanding palliative care services is another priority. Now with that, I'll end my presentation. But before I end, I want to reiterate again why we believe that this work is so important. We can always argue about the exact indicators that we want to put in a dashboard, or the color. Should it be a red color or a yellow color or a green color? The whole point is actually to think about cancer in a holistic way, to have a visual overview in front of us that covers all relevant areas in cancer care, and that follows in the footsteps of the Europe Speeding Cancer Plan. And the second point is to start measuring, to start monitoring and comparing the performance in cancer care. Because I think the principle of what gets measured gets done is very important and can be a guidance also for Greece. With that, I'd like to thank you for your attention. I also want to thank again HESMO and ELOC for their input throughout the preparation of the dashboard. And I want to wish you a great session for now, and then also a great conference the next few days. Thank you so much. It has been a pleasure. Bye.
Thank you, Professor Hofmarcher. It was a pleasure collaborating with you to have this dashboard.